Happening behind the scenes. 23 after the hour. Welcome back to Everyday Iowa. Today is National CNA Day. Here to talk about it and celebrate it, some friends from PRN Healthcare. I'm going to read the names and they're going to raise their hands, so we'll find out together who is who. Joni Bergermeyer. Sitting next to her, Stacy Porter. Sitting next to Stacy is Katie Hensley. Thanks, that's all the time we have today. No, first of all, CNA Day, happy CNA Day. How are you guys celebrating at PRN? And then what is PRN?
I feel like we celebrate every day. We do a lot for our staff, so we make them feel like they're welcomed. I mean, every day we're doing trivia, we send out gifts, gift cards, things like that. So PRN Healthcare is a staffing agency. We staff all over the United States. This region in particular, we do travel, long-term care, PT, OT, hospice, home health. We do a little bit of everything.
Okay, so hang on. KCRG, PRN, CNA. Oh, what was that one you just used?
OT, PT.
What is OT, PT?
Occupational therapy.
Oh, thanks for the FYI.
Therapy. You're welcome. So,
Joni, for those who aren't familiar with PRN overall, give us just kind of a refresher, and then we're going to talk to these guys. They've been sitting here so patiently. Who is and what makes up PRN Healthcare?
PRN Healthcare, again, it's a staffing agency where we go into different entities, whether it's hospitals, clinics, long-term care, dialysis. I mean, we just do a wide variety, and we help staff where the staffing shortage, where their staffing is short.
And are you seeing that in the Midwest? I mean, you said kind of region-wide, but is this from border to border, north, south, east, and west?
All over, yes.
Gotcha.
Yes. I would say traveling really went into effect more so when COVID happened because of the shortage of staff, people quitting, people getting sick, and things like that.
All right, Stacy, you're up. You ready?
Yes.
It's all the questions you've been preparing for. Tell me a little bit about traveling and doing stuff with PRN versus going to the same spot every day. Is there a difference? And a little bit about what you do.
There's a huge difference. So I'm a CNA, so we get to, you know, pretty much make our own schedules and go to different facilities. I like going to different facilities just because I don't have to go to the same one, work with the same people. You meet new people, different residents. If you care about what you're doing, you love what you do. Some people, if they're short-staffed, they don't always get that care that, you know, we provide at PRN, so it's good to make someone else's day.
Did they say when you took the job, hey, you're going to have to show up on live TV? Was that part of the job requirement?
That was not part of the job.
So, and next to you, Katie, correct? Katie, how long have you been doing this, and what's your favorite part of it?
Well, I've been a CNA for 16 years. I've worked with Joni for 7.
You started when you were 5, clearly. So.
Yes.
So, what's your favorite part about it?
My favorite part is being able to choose my own scheduling. If I don't want to work a day of the week, I don't need to ask anyone. I just don't pick up. And then the family atmosphere. I can call this woman at 4 o'clock in the morning if I have an issue.
And I bet Joni loves that.
And she does, and she never complains. But that's why I've stuck around PRN so long.
And Joni, I'm gonna draw a parallel, and you can tell me if I'm off base here. Is this kind of like substitute teaching a little bit?
Yeah, I mean, it is. You know, if there's somebody that's out sick, they can call a short notice, or if they have somebody who's on maternity leave and need like a 6-week contract, we can help fill that as well. Okay, so Katie, where are you based at right now? I mean, up here in eastern Iowa, northeast Iowa? Where's...
I'm up here.
Okay.
I'm traveling a lot to Strawberry Point. I'm covering a lot of hours up there.
Gotcha. Gotcha. And then Stacy, same question for you. Are you based around Cedar Rapids, or are you traveling a lot?
I travel between Cedar Rapids, Kelowna, Hills.
Gotcha. Gotcha. And then Joni, you just have an office, right?
I just have an office.
Well, I want to make sure people know how to get a hold of you at that office. How can they do that? Because this sounds like, you know, and we're going to celebrate CNAs here in a second. We're going to sing a song to you. Don't go away. But people who want to join this, everybody showed up with a smiling face. We know how stressful healthcare is, but it seems like you guys are making the most of it.
Yeah, absolutely. So if anybody would like to join our team, again, we are family here. We try to make everybody feel like they're part of something other than just a number. You can go to prnhealthservices.com and fill out an application, and one of our recruiters will be in touch with you. If you are a client, as such as a facility or a clinic or anybody that's looking to have staff or need that coverage, again, you can go to prnhealthservices.com, and there's an application in there that you can fill out, and we will contact you.
I'm being told we ran out of time for the song. I'm sorry, guys. But thanks for coming in. Happy CNA Day. Come back and visit too, all right?
Thank you for having us.